I currently advise the Department of Defense. I'm on the Defense Health Board after 20-year military career. I advise employers and healthcare organizations, and I firmly believe that selective innovation in disruptive technologies, such as shared decision-making, lifestyle medicine, musculoskeletal surveillance and prevention, as opposed to just telehealth treatment, how we use drugs, and the rewiring of the brain that occurs all the time that we now know how to accelerate, which is essential to good health and essentially higher performance for businesses in our country, frankly. So in the upstairs window is when I probably first met Ron Stout as a flight surgeon in the Air Force, but it changed my perspective about what healthcare was about. Healthcare is there to produce productive employees and organizations and in the Air Force to fight and win. Healthcare in many cases is drag and not lift, to use an aviation model. It was a single payer system. It was value-based because it was all about performance. And it really was my job when I rose to the Surgeon General's office was to have the least amount of medical footprint possible for the highest amount to serve the American public. I was so convinced that health plans created zero value. I oversaw the TRICARE program that I created along with 3 other people, Luminas, the notion that it's all the employee's money. It's not the employer's money at all. It comes out of their paychecks. And for 6 years, we created consumer-driven healthcare with health savings accounts, health reimbursement arrangements, the first transparency tools on drugs and procedure costs, and incentives for healthy behaviors and health coaching. Much of that stopped completely in 2007 when we were acquired by WellPoint Anthem, the nation's largest health insurer at that time with 40 million members. I came to Pittsburgh and I started to work to build things that they didn't have at UPMC called coaching programs that we used at Luminas. And over the years, I've encountered all the usual suspects to Casablanca with all of their biases and all of their misaligned economic incentives and all of their incentives really to keep what really drives health and effective healthcare out of the public eye. So the current practice leads to mutual burnout, both an overweight patient and an overweight doctor. Give it to me straight, how long do I have to ignore your advice? And this is how we spend 20% of your grandchildren's GDP in a very frustrating scenario that doctors and patients have pretty much said enough. About all of these diseases are caused through a single common pathway called inflammation. And all of the science that didn't exist when I went to medical school or when Ron and Wayne were classmates is now clear that the microbiome, epigenetics, and cellular stress, this is hard basic science that can be translated in a disease, not only treatment, but reversal through addressing the 6 unhealthy lifestyles on the left-hand side of this chart. The lifestyle interventions have arrows that go both ways. And doctors don't yet believe it. Certainly nutritionists don't believe it. Many people in medical care don't believe it, but it is a god-awful truth and it is transformative. Every one of these diseases is caused by inflammation, but they hide in specialty clinics. They hide in so-called centers of excellence. They hide in organ-specific diagnoses, but the common pathway, no mistake about it, is inflammation because the world is hungry for a new solution. And it's not about seeing more specialists or more advanced models of technology, but it's really to address plant-based eating, restorative and repairing sleep, regular physical activity, elimination of addictions, tobacco, alcohol, and others, stress management through self-techniques and the environments we build, and healthy relationships with purpose. If you get these 6 things right, you generally don't need a doctor pretty much at all. Frankly, colon cancer actually declines dramatically. People in the blue zones live to be 100 without chronic disease with a very light footprint of so-called medical care. I've always known that the white coat of the doctor carries a lot of clout. I was privileged to be at UPMC, build up health coaches that can be prescribed by doctors, making the power of Dr. Deisinger's voice become multiplied and reverberating as if it will through a megaphone. And when you do that, what you find in this nationally award-winning study that we did about 2 years ago is that you get 300% the engagement and the better outcomes, whether it's losing weight, becoming more physical activity. And the notion of medicalizing prescribed coaching is something that is very powerful and is the platform for energized primary care with lifestyle medicine as its focus. So my take homes to improve health and healthcare after 40 years of being at this, it's all about root cause. Find the root cause of disease, which is lifestyle and the environment around it, and eliminate rapidly excessive cost and waste, which some of the employers that Daryl has at his meetings have tried to do. Lifestyle and preventive medicine is the cornerstone of primary care. Deliver innovative on-site, near-site care with prescribed coaching baked in, and be very, very selective with who specialists you talk to. They should have a conservative philosophy, particularly in cardiology, orthopedics, and cancer, and emphasize shared decision-making.
One of the things that I learned at Procter & Gamble is the power of purpose, and particularly the power of purpose in the hands of leadership and individual lives. And that is something that we really leveraged within our approach to healthcare. And this is asked all the time, but why invest in well-being? But our belief system was that we invested in well-being to give our employees the energy to perform at their peak and accomplish not only our corporate purpose, but their individual purpose, their individual goals. And focusing them on those goals and the why of what they wanted to accomplish and the barriers to accomplish it led us to this emerging belief that you can't scare people into health. And I don't want to offend any vendors that might be on the call or not, but we've all done it. We've bought the apps. We've done the Know Your Numbers campaign. We've had this belief that if we just remind people of their horrible weight, their cholesterol, their blood sugar, whatever, it's going to somehow change how they care for themselves and care for those around them. And what we came to learn is that sustained health behavior change really only occurs when connecting, optimizing health and wellness is directly connected to purpose, to the why, to why I'm living my life and what's important to me. And one of the frameworks that we use is here, and this is actually the foundation, if you will, of how we approached health. We talked about enabling peak performance, well-being by inspiring meaningful, happy, and healthy lives. We talked about the meaningful heart, the pride in who we are, and connecting with others that are of like passion. The necessity of calming the mind and having a happy mind, and then the value there is in having a healthy body to give you the tools, if you will, the energy to accomplish your purposes. In the end, we learned that successful corporate well-being had 5 basic precepts. One, it had to be leadership-led. You had to have visible leadership where it counts. Head of the company, head of the business, head of the household. We recognized that we needed to connect purpose and health. And then, just about as importantly, we recognized we had to help create environments where the healthy choice was the easy choice. At times, the only choice, if you will, because it is very difficult to walk through life making the perfect choice when all around us there are other choices being made. But one of the ways of enabling that good choice is by the development of self-sustaining social networks, by creating environments where people of like mind come together and go on similar journeys. And then lastly, yes, indeed, sharing information. That's Know Your Numbers. How much do you weigh? How do you, what's your cholesterol? What's your hemoglobin A1C? But this comes after and a person has identified their why and identified the journey that they want to go on. We had our physicians enabled to understand who their patients were, to go on a joint journey with them, and to partner to optimize their well-being based on the individual's why and their purpose.
I used the analogy yesterday, and I'll say it again. Healthcare is often built at the bottom of the cliff to fix people who fall off. And prevention is about putting a fence at the top of the hill so that people don't fall off in the first place. But there's one step further, which is true aspirational healthcare. And that is journeying with people on their path through life, helping them reach their potential and living life to its fullness. And you just described that with the why, as well as anybody's done that. And the fact that Procter & Gamble put a focus as a corporation on asking their employees, Are we delivering you the support to reach your why? And if we're not, how can we better do that? It's one of the best examples of a corporation doing what the NUCA system up in Alaska has done, which is not just focus on the hospital at the bottom, not that those don't have to exist, because they do, and not just focusing on prevention and immunizations and putting business at the top, but really journeying with people. And I love your description of the why. That's what it is. What is your purpose in life, and how can we help you reach it?
I want to point out here that what we've developed over time is a sick care system that's based on the scientific concept of reductionism. And reductionism basically says, my job as a doctor is to figure out what's broken and then to fix what's broken. That's what I'm trained to do. That's what my job is. Figure out what's broken and fix what's broken. Lifestyle medicine is saying this is wrong. We actually are not a bunch of parts that can break and get fixed. What we are is this whole being that interacts and is vibrant and has much more to it than the sum of its parts. And so in lifestyle medicine, my job is not to fix what's broken. My job is to bring the system into balance. My job is to bring robustness, the ability to adapt. And when I bring that balance into my patients, then guess what? Their bodies themselves will fix what's broken to a large extent. The top two levels being what I was trained in medical school and residency, and being what most of our healthcare system is built around, doing procedures and writing prescriptions. That's really what healthcare has been. But if we look at what are the costs of healthcare and what are the reasons my patients visit me, 80 to 85% of them are related to chronic disease. So these are things like diabetes, high blood pressure, also things like depression and arthritis, any number of illnesses that has been around for more than a couple weeks in a person's life. That's what I spend most of my time doing, is working with chronic disease. And if you look at chronic disease, 80 to 85% of chronic disease is directly caused by our lifestyle choices. So that's the four pillars that are listed in the bottom part of this triangle. Are we eating healthfully? Are we moving? Are we managing our stress and our sleep in what we call resilience? And are we connected to others, as well as we talk about vertical connection, which gets to Ron's discussion about purpose and meaning. So the last sort of philosophical definitional slide is around value-based care. This is a term that's being thrown around a lot right now. It's a term that healthcare investors are finding it attractive to invest in. And what is healthcare? What is value-based care? Well, the definition that I like is the one that works around the Institute for Healthcare Improvement's triple aim. And the triple aim is basically, we need healthcare that has great clinical outcomes. We need healthcare that has great cost outcomes, that decreases the expenses. But we also need healthcare that patients are very happy with. So we need the balance of those three. That's what value-based care is. One of the truisms in business is that you manage what you measure. If we're going to measure something, then we're going to end up spending a lot of time trying to fix or manage that. So one of the things that my practice does differently and that lifestyle medicine does differently is we measure differently. So this is a room in my practice. So this is what one of our typical consult rooms look like. Very different than the typical patient exam room where there's the exam table and you're used to sitting up there feeling exposed and half naked. In our exam rooms, you sit in a regular comfortable chair and we have a consultation, we talk, because that's what dealing with chronic disease is about, is talking and working through how we can change our health behaviors. So what we measure in lifestyle medicine, we measure the four pillars that I talked about, the nourishment, the movement, the resilience, which is sleep and stress, and the connectedness, which is the horizontal social connectedness and the vertical purpose and meaning. We measure those in our patients, and we measure the triple aim. So we measure, are our patients happy? Do our patients get good clinical outcomes? Are we saving money for our patients and for the healthcare system as a whole? He showed up again literally 3 weeks later. So you can look here, literally 3 weeks later, and this is how much his cholesterol had dropped. The total cholesterol had dropped 55 points. The bad cholesterol, which is that LDL cholesterol, that had dropped 41 points. The HDL, which is a good cholesterol, had stayed about the same, which is what we wanted. And the triglycerides had also dropped. So overall, he dropped 0.25%. So it's an amazing story, all from just one lifestyle prescription. I want to finish up with this slide. This is additional data. This is data from my practice. And what I want to show is that we're meeting the triple aim outcome. So we're dropping cholesterol, we're dropping hemoglobin A1C, we're dropping people's weight, and we're doing this by decreasing their medication, not increasing their medication. We do this because we start off with relationship-driven care, and we apply lifestyle medicine on top of that. But then we also apply value-based care. So we go for that triple aim, and we're blessed because we are reimbursed in a value-based care primarily through Medicare. So the biggest value-based care reimbursement payer right now is Medicare. And so this data shows, number one, our patients are super happy. They love our system. But number two, we're dropping the total cost of Medicare for our patients by 40%. That's amazing savings, 40% drop in Medicare costs.
In every community we could go into, Daryl, we looked at employee-owned companies. They are a driver for change because there the employee understands the company is my company. And if I'm spending too much money on Dr. Parkinson and I go to Dr. Stout instead, and he's actually a better doctor, I think I want to do that. And I'm not going to be blindsided by that status quo. So I would say a strategy would be to find, obviously in the Fortune 100 companies, you've got them pushing for Walmart's the center of excellence, but Americans don't tend to work for those companies, or they're a small sector. The unions also have not been helpful here. Self-funded unions are an ally, and we should go after them. But most unions, the value proposition was told, Mike, don't worry about healthcare, we'll take care of it with no cost. A rich benefit is dangerous to your health. Let me say that again. A rich medical benefit is dangerous to your health.